I hope you are doing well, and I welcome you to our today's sensitization. And our today's topic is going to be on the types of hypertension. And today we are going to have a look at the second type of hypertension, which is called the secondary type of hypertension. Now, before we have a look at the causes of the secondary type of hypertension, allow me give you some brief overview about the secondary type of hypertension. As you can remember, the secondary type of hypertension is actually the second common type of hypertension. It accounts for about 10% of all the hypertensive cases or the hypertension cases. And it has got identified known cases that when handled properly, then the problem can get resolved. Now, sometimes it may be difficult for one to arrive at this type of hypertension. But then how can we have a clue, or how can we start being suspicious that one could be having a secondary type of hypertension? How can you, as a patient, start thinking that you could be having this type of hypertension? Number one, if you are not responding, or if one is not responding to the antihypertensive medications. You've been put on antihypertensives for a very long period of time, and the pressure is still on its steady rise. There is no any response, no positive response. At that point, one should start suspecting the secondary type of hypertension. The second thing is that this type of hypertension has got no family link. So if there is no any history of hypertension in one's family and presents with high blood pressure, then we should start suspecting the secondary type of hypertension. Number three, this type of hypertension is of actually sudden onset, and surprisingly, it's realized mostly in very young ages. So someone aged 30 and below, someone who is still in his early 30s, is being told that his pressures are high. So hypertension being diagnosed or realized at a very early stages or early ages makes one to start thinking about the secondary type of hypertension. The fourth clue is that sometimes the patient may not be obese. So if one is not obese, there is no any element of obesity based on assessment, but presenting with high blood pressure, then we need to start thinking about the secondary type of hypertension that has known causes. So very quickly, let's now have a look at these causes of the secondary type of hypertension, and we'll be able to classify them as per systems. So number one, and to our viewers who may not be having medical background, please, at this point, it may be difficult to avoid some terminologies because some of these terminologies may not have any better word that we can then use to refer to them. So we just have to speak them out as they are. At your free time, you may then proceed to go and check on each and see what it means. So the first class is on the renal classification. What are some of the renal diseases that can cause secondary hypertension? When I talk about the renal, I mean the kidney diseases. So the first kidney disease that can cause secondary hypertension is called the diabetic nephropathy. So therefore, patients with diabetes or high blood sugar stand a chance of developing pressure in this manner, that the high blood sugar can damage the kidneys, and then we end up with the secondary type of hypertension. As you can remember, kidneys play several functions, and one of the key functions is control of blood pressure. So if it is damaged, then it cannot have the capacity to control one's blood pressure, particularly in those who are diabetic. Diabetic nephropathy is very common and is actually associated with high blood pressure. The second condition or disease of the kidney that can cause secondary type of hypertension is called the polycystic kidney disease. These are formation of cystic fibrosis or cysts that can then compromise the normal function of the kidneys, including the control of blood pressure. The third kidney disease that can easily cause hypertension or secondary type of hypertension is what we call the renal stenosis or renal vascular diseases. In simple words, this is the narrowing of the renal blood vessels so that we have stasis or slow flow of blood within the kidney, compromising its functions. Now, the second classification, having dealt with the renal classification, is what we call the endocrine classification. So in simple words, what is the endocrine? Endocrine is now the system that deals with the production of hormones. So these hormones are very crucial to the body. And if they are produced in an abnormal manner, particularly in excess, then they can link or they can lead to secondary type of hypertension. So let's look at them one by one. The first one is excess production of aldosterone hormone. And this hormone plays a very key role in the control of blood pressure. If it is produced in excess, one can develop a secondary type of hypertension. The second endocrine cause is what we call the pheochromocytoma, which is a tumor of the kidneys that then can result in production of excess chemicals that can then build up the blood pressure, leading to secondary type of hypertension. The second endocrine disease is what we call the Cushing syndrome. This was another very common condition linked to secondary type of hypertension. Of course, they are related to hormones or hormonal production. The next hormonal condition or disease that can cause secondary type of hypertension are what we call the hyperthyroidism and hyperparathyroidism. The two can equally cause excess thyroid hormone levels and so increased blood pressure, and that becomes a secondary type of hypertension. Other causes of secondary type of hypertension include 1, sleep apnea, number 2, coarctation of the aorta or narrowing of the main artery that actually removes blood from the heart to all parts of the body. So if it narrows, a condition called coarctation of the aorta, and this can take place right from birth. Now, the other cause or secondary cause of secondary hypertension is also what we call pregnancy. So that we have pregnancy-induced hypertension. As people can remember, that pregnancy is very common. Hypertension is very common in pregnancy. What people call preeclampsia, high blood pressure in pregnancy. Blood pressure coming as a result of a pregnancy. That is the pregnancy-induced hypertension called eclampsia. So you see, it's a blood pressure high blood pressure that has come as a result of the existing pregnancy. And once that pregnancy is delivered, then eventually it will go away. Now, other medications, there are some medications or drugs that can also result into secondary type of hypertension. And they include, and not limited to, 1, the pills, what our beloved women use for contraception, that is the combined oral contraceptive pills, have been identified to be contributing or leading to its use has been identified to be one of the causes of secondary type of hypertension. Ladies and gentlemen, I want to thank you so much for taking your time to listen and to watch. And please, let's continue, for we are out there for the better health, a better health for everyone. You can only do everything and anything if you are healthy. Until next time, it's goodbye from all of us.